Hi, good evening, everyone. So, I welcome you all to the Unacademy. So, it's a wonderful session. Today, I don't have to teach anything. So, I'll be interacting with you all, and we'll be seeing some interesting conversation. Yeah. So, before that, so we at Unacademy have an iconic subscription where you can join Unacademy and Prep Ladder together, and that too for a very cost-effective. You can say at a very cost-effective, it's a very cost-effective solution, and we have this NEET PG combat. So please don't miss on 10th of October. Yeah, we have excellent scholarship programs for you. So just last just just a minute, students. Just a minute. Some problem with this. My device is not catching. Just a minute. Just a minute. Okay. Okay. Just a minute. There's some problem with this iPad. It's not coming. So results announced. Yeah. Just a minute. Some problem with this iPad. My video capture device. So just give me 1 minute. It's not taking this. Hi everyone. Okay. So last reminder before the prices are going to rise, and we have a lot of options and lot of special features also. We this is the only platform where we have you can raise a hand feature where you can talk to the consultant. You can talk to your educator. This is a great feature. And an academic question bank, you all know it is going to be the more interesting. So yes, hi, how are you doing? Yes. So I hope most of you must have planned by now that what do you want? What are you planning at? So let us talk today on a very interesting topic, that is surgery as a career. The results have been announced. When? Just now. Okay. Okay. So let us talk about this very interesting. We don't have to write a lot. Let us see surgery as a career option. So surgery as an option. Yeah. What do you think? What do you want? What queries do you have? For me, it is always, you can say, always a go ahead. What are your queries? Surgery as an option as a career. Come on. What are your queries? First, I'll answer your queries, and then. When we talk about surgery as a branch, there is no branch equal or parallel to surgery. Yeah. And I don't think one should be always motivated to take surgery. Yes, there are a lot of thoughts that you have to be strongly motivated to take surgery. Yes, it is true, but many of the females are now also opting for surgery. It's not like uh, a subject anymore. It's a passion for a lot of things. Lot of thing. There are a lot of things. You don't have to think about the money. You don't have to think about the hard work. It's just the passion. If you are passionate about this branch, yes, this is your branch. Now, average cost of own setup in peripheries in metro. Yes, is asking. Okay, okay. So I'll collect all your questions and then I'll answer all your things now. Because if you ask me to speak on surgery as a branch, I will continuously speak for 10 days, 20 days. Because for me, it's the best branch that we have. So I'll answer all these questions. Meanwhile, you can type, and I'll just take 5 minutes of yours to explain about this branch. Surgery is a very decent branch, but you have to understand it's a hard working branch. It's not for all. It's only for the people who can enjoy this sheer pain also as a pleasure, because you need a lot of commitment. Suppose you have operated on a patient, yeah, and when you go back to your home, you get a call from the hospital that sir, patient is actually bleeding, or sir, patient has not passed urine post surgery, or sir, patient is having respiratory distress, or patient is having abdominal distension. So actually your whole night will go off. You cannot stay comfortable then. You have to go to the hospital, be it 3 a.m., be it 4 a.m. So this is actually a branch which requires a lot of endurance. So let us have a, you can say, a common man's notion about surgery. Yes, you have a lot of respect in this branch. Lot of respect in this branch. We often feel like kings. Sometimes we feel like kings. Why? Because we are the most dominating person in this medical field. Surgeons are the most flamboyant, most dominant person. We know that when we enter into the game, it is either yes or a no. Because surgery is not the first line management for most of the things, it is only the last. So people have a lot of respect and gratitude, but that comes at a lot of dedication. For you, it could be a sleep for 10 minutes. Imagine you get a call from hospital that yes, there's a trauma, you need to attend that patient. You have to attend that patient because a sleep of 5 minutes can change the entire life of that patient. Yeah. That patient might collapse, that patient might succumb, and then the complete family, all the people who are associated with that person will be affected. So bacho, this is not an easy branch. This is really a tough branch. The second thing that you have to understand is it takes a lot of time to settle down as a surgeon. Now you feel that okay, you will do MS, you will do DNB, it's okay. Then you will do MCH, yeah, or you will do the DNB SS, and then you will get settled down. This is not the reality. This is not the reality. You will have to sweat out in the market to prove your mettle. Is that clear? Because when you enter into the market, no one is actually knowing you. And as a surgeon and as a physician, people have two different perspectives. They are reluctant to go to a new surgeon. Why? Because they don't know the expertise. They want their near and dear ones to be operated by the best of the best person in the market. And the second problem is already there are there are big players in the market. So how can you replace them? Either you wait for their retirement and then you replace them, or you have to be extraordinarily smart, agile, dedicated and hardworking. Because young surgeons have a positive thing that they have maximum availability. It's not like they will not attend a call at 3 a.m. in the morning. Yes or no? So try to understand, yes, it's a hard-working branch. But once you establish yourself, sky's the limit. Remember students, money is not the coefficient of happiness. So if you are thinking that you want to be rich and that is why you want to become a surgeon, it's absolutely wrong. You have to have that obsession. You have to have that passion for that branch, this branch. Yes. The second thing is, this is the most rewarding branch as far as finance is also concerned. But it takes some time. And this is in fact with every branch. But yes, once you are settled down in the market, you are actually going to rule. People will come out. People will come out for you. People will say, okay, like let me tell you about my small story where I started with the career. I have operated a gallbladder even for 1500 rupees. Yeah, CGHS patient, you don't get a lot of things. Today, even if I get a CGHS patient, yeah, I say if you want to get operated from me, I'll take my share of money. So that same 1500 has now changed to what, 55,000, maybe 60,000, maybe 17,000, 70,000 also in certain cases. And the patients are willfully giving because they know that yes, he's the person who can handle this scenario. So it takes a time. And then there is no scope of error. In surgery, there is no scope of error. So yes, it's a very rewarding branch, but you have to be passionate. If you are passionate about this branch, then sky is the limit. If you're not passionate, then again the sky is the limit. I'll talk about more things, but let me take your queries first. Like Yash has asked me a question, sir, average cost of own setup in periphery and metro. Try to understand what kind of surgeon you are. The first thing is what kind of surgeon you are. Suppose if you have done MCH neurosurgery, yeah, and then you settle down in a periphery, you'll find that periphery to be more lucrative, but you are contained to very less cases. You only get EDH, SDS, SK lava, or you don't get anything because the setup is not supporting. If you create a setup also, then you will not get that big load of the patients. Yeah. So remember what specialty you are choosing. Based upon that, you can decide where you want to settle. Of course, setting up an own setup in a metro is virtually impossible nowadays, right? Because you have to meet with the corporates. So if you want to open up a hospital, like in a city like Delhi, a small 25 setup or 25 beds or 30 beds, you roughly require a lot of amount, because you cannot set up a nursing home and you cannot set up a clinic and say this is my setup where I'll do a surgery. So it takes a lot of amount. Like I have opened a new hospital, yeah, I bought that place and this and that, everything, and my project cost me around 15 cr. So 15 cr is not a small amount. You'll spend your whole life earning that amount, and then at the end of the day, I don't know I will be able to make up that amount or no. But yes, I wanted to open, so I did that. So students, it's very important that where you want to settle down, and same setup, same level of setup. Had I planned in the periphery, I would have settled it at less than half a cost. And this is really very, 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 very important. Very important. So where you are working, and again, the advantage of working in a metro is there are a lot of perks which you enjoy. Why? Because in a small setup, you are having only you can say a nutshell of people coming to you, and same type of cases. You don't get a variety of cases that you want to operate. So yes, setups, even though are costly in corporates, in the metros, they're more profitable. Yes. Yeah. Periphery, the advantage is you settle down early because there are lesser number of doctors. So demand versus supply is totally different in periphery. Everyone wants to settle in big metros. So their demand is also there, but supply is equally, you can say, balanced. But in peripheries, the demand is always there. Doctors, everywhere you have scarcity. So that is what is the big thing. So don't think about setting up your own setup right now. First think about becoming a surgeon, then assessing whether can you handle a setup, because students, a setup comes at a lot of things. You have to think about a lot of managing skills also, which you might not be perfect at. You may be a good surgeon, but you may be not a good administrator. So ye अलग चीज है. So Aviraj has asked, other than central institutes, which other institutes are best for surgery? First of all, what is surgery? What is MS surgery? It's a license. It's a license to put an incision, to make an incision. And remember, always, every college is nearly plus or minus good. It has to be a registered college. You should understand, when you are moving from one state to another, don't go for recognized courses. Don't go for approved courses, approved seats, because there is a drawback. Suppose if you are living in Delhi, and if you go to suppose West Bengal, and there's a new medical college has been opened and they have 5 seats approved for the surgery. But these approved will get recognized later, and by that time you cannot practice because the state medical council has given the approval for that. So by the time these approved seats get recognized, you will not be entitled to work in Delhi. So remember, when you are moving from one state to another, you have to understand one very important thing, that what are you targeting at? Yeah, you want to settle there, so, or you want to come back to your own place. So recognized versus approved seats, first thing you have to remember. The second thing, you need to go to an institute where you get to learn a lot of things. Remember, once you pass out of MS, you have that license, so you can cut anyone. But if you don't know how to cut it properly, you'll soon lose your fame. Is that clear? So there are a lot of people who say PGI is not good, AIMS is not good, JIPMER is not good in surgery, yeah, IPGMR is not good in surgery. There are a lot of people who talk about big institutes. Why? because they have lot of specialities, so patient gets bifurcated in all the specialities and we get less. Students, try to understand this is a time when you need maximum exposure. When you are doing MS, you need to have a bite from each and every field, so that at least you know, you see, rather than getting those patients later in your career. And when you are not knowing that patient, you're not knowing that thing, you have not seen that patient, how can you justify yourself? Yeah, how will you be able to treat? And then will you ask your colleague there, यार tell me, मुझे बता दो यार इसके steps कैसे होते हैं यार, ये patient कैसे approach करना है? So that is again, so go for a good college where you get to learn the things, not for a college where you get excellent cuttings. Because peripheries, you don't have, you can say, a big strong infrastructure. So वहाँ पर क्या होता है ना, cutting hands बहुत मिल जाते हैं. You do a lot of laparotomies, but what will you get today? How many of the surgeons, when they pass, they do laparotomy? 3 years ago, I did one laparotomy, and then after that, last year, after that, 3 months ago, I did. So 3 साल में 3 laparotomy बस. I do all minimal access surgeries. Even perforation, if I want to do duodenal perforation, I will prefer to go it for a laparoscopy. So will you get this thing in a periphery? No. So always put the central institutes and the big names first. Yes, if you're not getting, rather than wasting your year, go for a seat, go for a recognized college, go for a recognized, not approved. And remember, once you complete MS, give yourself some time, practice in a good hospital as a SR for 6 months, you'll equally get trained, or whatever is your field of interest. And then second thing is, now there are people who have made their mind that, oh, I want to become a urologist. When you want to become a urologist, MS is just a degree for you. Is that clear? So why people are so frequently opting for DNB surgery when you don't get a lot of things to learn in DNB surgery? I will always discourage DNB surgery from private institutes, private hospitals, because they don't teach actually. उनका कोई stratification, उनका कोई, there is no standardized, you can say, modus of operandi, कुछ नहीं होता है, SOP नहीं है उनका कुछ. So try to understand. If you have decided, no, I'll do super speciality, and for me, it's just a degree that I will need to qualify. You can do it from any institute. Periphery se karo, central se karo, hardly it matters. Yes. So I hope, Aviraj, I have answered your question. And all the central institute, jitne metro cities mein, they're all good, doing good. So Roger has asked, in the Northeast India, which institute is best for surgery? When you talk about Northeast, Guwahati is very good. Guwahati is good. Silchar is good. So Guwahati and Silchar, they are very good colleges in Northeast if you talk about. Then RIMS, Shillong, again it is very good. You get a lot of good things. So Shillong is good, yeah. And then Guwahati is good. Silchar is good. In Northeast, yeah, you get a lot of things. You get a lot of things to practice, yeah. So it's good. So let us see. There are a lot of messages. First of all, congratulations to those who are actually getting a good score. And right now, I cannot comment anything for the scores because it's too early. Until we have a cumulative data, and then we can decide. We can talk about the ranks, and then only we can decide, because every year the things fluctuate. At 1 marks, you have a lot of ranks clustered. So definitely you will get everyone will get their piece of branches that you want. And don't worry, even if you are not able to get this time, again next time. But you remember, when choosing a branch, get obsessed to yourself. Do not compromise with the branch. There is no age limit. So let me tell you about, you must have heard of Palani value. Dr. Palani value is one of a very good surgeon, and Dr. Sailesh Kundambekar sir, they are very good, they are excellent surgeons, and they are renowned in the world for their laparoscopic skills. Do you know, they were half the age, they are in their late 40s and 50s, they were in the late 40s. When they actually started with the laparoscopic surgeon, do you know they have conquered the world now? So there is nothing like age. Age is just a number. वो कहते हैं ना, age is just a number, and it really means if you are passionate about your branch, if you are passionate about surgery, if you're not getting, wait rather than compromising. Because MBBS as a college, or PG as a surgery as a college, or PG seat as a college, no one is hardly going to ask whether you did surgery from Jabalpur, whether you did surgery from Dibrugarh, whether you did for AIIMS, from AIIMS. Actually, you did surgery, that is what. You did medicine, that is what. Is that clear? So congratulations, Mayank also. So congratulations all those, yeah, her. So yeah, definitely, definitely. So try to understand. Don't mess with your life, and don't let anyone mess with your life. If you've decided you want to become a surgeon, you have to become a surgeon. इस साल नहीं मिला तो क्या हुआ? You'll get it next year. You'll get it next year. Who has said being a doctor, like, we are always depressed? Why we are depressed? That, oh my God, sir, my friend has qualified this and that. You are looking only at one frame of reference. What is that frame of reference? Your peers, your friends. Like, I had a lot of friends in my college life, but today I don't have anyone talking to me, and I also don't have time to talk to them also. I'm very unfortunate that I cannot talk to my friends. It's not like I don't love them. I love them, but I cannot talk to them because I'm not getting that much of time. So try to understand that these things are aside. When you see from the general populations, you can say frame, they say, oh my God, he's a doctor. उनको तो ये भी नहीं पता what's the difference between MBBS, MS and MD. Is that clear or no? So this is very important. Don't think you have already, being a doctor, you have already secured a minimum level of job security. खाली नहीं बैठोगे, भूखे नहीं बैठोगे. Even the pandemic has proven this. Is that clear? So live happily, live cheerfully, do the branch what you want it to be. It's not like कि भाई इस साल मुझे करना है क्योंकि शादी होने वाली गर्लफ्रेंड की, अगर मैंने नहीं करी तो मेरे से शादी नहीं होगी. बच्चे, you will never be happy. Break yourself free. This is your branch. You have to own it. So Aviraj has asked, laparoscopic exposure is there in MS general surgery. But unfortunately, everyone wants to do minimal access surgery, laparoscopic surgery. But I should not be saying, but the quality of laparoscopic surgery that is being done in the medical colleges, this is pathetic. This is pathetic. And many of the teachers, why the problem is because many of the consultant over the time, they started with open approaches for many of the surgeries which they are doing, and then they are evolving themselves. So you people can learn laparoscopic surgery far, you can say, far better than them. Why? Because you don't have to change your frame. You don't have to change your opinion. You are developing in an era where minimal access surgery is ruling. Yeah. And we have a lot of new institutes coming across the globe. Like, I have also started my own laparoscopic training institute, which will be starting in the month of November. Everything is ready now. Very soon, my website will be flashing that information very soon. So we have a lot of hands-on training courses, and then laparoscopy is a skill. It's not a branch. We'll have to evolve it over the time. And there are, leave laparoscopy apart, there are a lot of branches. You have plastic surgery, that is aesthetic. In India, come role hai, but yes, people in metros, they are crazy about plastic surgeons, and plastic surgeons are really minting money. Yeah. You know, for hair transplant or for contracture correction or scar correction, या एक लड़का है, उसकी नाक छोटी है, वो कह रहा है डॉक्टर साहब मेरी शादी होने वाली है, उसकी शादी की कीमत है 2.5 लाख. आपने कहा 2.5 लाख लेंगे, 2.5 लाख लेंगे. Cost is not justifiable because this is now commodity, this is now product driven. आपको पता है कि शादी होने वाली, वो 2.5 लाख देगा. Yeah. So this is what. Definitely. Maybe next year I also come up with a DNB seat at my institute. I'm planning to apply for at least 2 to 3 DNB seats. Don't worry. So अगर कोई आएगा तो that will be you can say heaven for surgeons. You'll learn a lot. Anyways, so we have oncosurgery, we have surgical gastro, we have neurosurgery, we have urology. Why don't you people ask me, sir, which branch should I prefer? Yeah. Why don't you ask me the questions, sir, what should be my choice? Yeah. What is my, I want to be a surgeon, but I have some limitations. I don't want to do emergency. I'll say urology is your cup of tea. Why? Because a patient comes to you with urine retention, you can only do SPC and then we can see what happens next day. So you call RMO, medical officer, you say do SPC puncture and this is done. Yeah. So this is very important, Kevin, to select a branch. So what you want surgery, you want medicine, you want parasurgical branches. So first thing is you have to decide this. And then you have to decide where you want to settle down. Suppose if you want to settle down in a tier 3 state city, in a periphery, and you are thinking to go for a cardiovascular surgery, yeah, CTVS आप जाना चाहते हो. So what you will get at the end of the day, you'll get nothing. You'll get nothing. CTVS is a setup dominated branch. आप अपना खुद का setup नहीं लगा सकते. It's very costly. Heart-lung bypass is somewhere around 2.5 CR with GST. It's very costly. I was planning to induct this in my hospital, but I couldn't do because cost नहीं है. Cost अगर होती भी तो इतने clients नहीं है. Yeah, there are a lot of things you have to decide. So choosing a branch, you have to work hard during your residency. And what is the best part of getting a residency in a good college is because you have all the super specialties. You work there as a rotational, you can say resident, and during that rotation, you actually do the work. When you step into the shoes of a urologist, when you step into the shoes of a you can say neurosurgeon or maybe a gastrosurgeon, whatever you say, oncosurgery, plastic surgeon, then you get to know that whether you want this or no. Because बाहर से बहुत अच्छा लगता है, but when you actually do that work, perform that thing, it is then you fall in love. Then you are able to decide. This is very important. So amazing elderly, someone with hand tremors or dystonia, should they take surgery? Students, nowadays that surgery is not that, you can say, coarse blunt movements. They're all fine movements. Yeah. So yes, if you have a significant hand tremor, you should not be going for. But if you have minor level of hand tremors, you can always. Sometimes people don't have tremors, but they have intentional tremor because of the fear that they will commit an injury. This happens with everyone. So the first time you'll get a scalpel, you'll not be able to make a straight incision. Yeah, I still remember my boss, Professor Abhimanyu Basu sir. So when I first saw sir making an incision, oh my god, I was mesmerized. One single incision he made during laparotomy, skin, subcutaneous tissue, fascia, everything was cut in that single incision. And when I made the incision for my first time, I was cutting the skin and then again making an incision, again cutting then fat and this and that. So it takes a lot of time. So today I also make that very flamboyant like incision, a deep incision, because I have that, you can say, texture detection, or you can say pressure detection. I know this much pressure to be applied over this, है ना? ऐसा नहीं कितनी तेज कर दिए पेट तक काटते हुए चलेगा ना. This is very 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 important. Yeah. So if you have a significant level of hand tremors, you should avoid it. But minor tremors are always there. So intentional tremor है कि true tremors है, you have to find this all. Yes, I want to do orthopedic surgery. What is the future of scope for orthopedic surgery? Is always good. Trauma you cannot stop. Fractures is always going to happen. So your bread and butter is always is going to be fractures, है ना? And now you have a lot of smart, you can say, super specialties in orthopedics also. You can do a spine fellowship, you can do. So ortho is always a very good branch. It has been evergreen branch. So you can always go for any branch you take, you will be happy. But yes, when you want to become a surgeon, you have to decide you wanted it or no. So VMMC, UCMS and KEM, which one is best? They're all best for MS surgery. Because students nowadays, MS surgery hardly matters a lot. Yeah, hardly matters a lot. And you have to understand that you should get minimum level of exposure. So in all of them, you get that. Yes, if you talk about UCMS as a college, UCMS might be considered, you can say, back in the ranking. But when it comes to super speciality, majority of the cases of the gastro surgery, surgical gastro, are referred to UCMS. Yes, so you have the GTB attached to that UCMS. So ये बहुत बड़ी important सी चीज़ है कि where you get the exposure, variety of cases. So all of them are equally good. KEM is good, BMMC is good, UCMS is good. Amongst them, uh, I would say I would have gone for UCMS and KEM, and then I would have preferred BMMC because I know everything. BMMC college wise is very, very, very good. But of late, I know what happens. The referral system, the patients are admitted, and you have a limited, you can say, exposure nowadays. You getting limited exposure. I would have kept UCMS above BMMC when I would have planned for what surgery. बाकी दोनों ही equally good है. So Prince Zuko said, nice timing for this video as soon as the result came out. How sir you get any insider information? नहीं. देखो, it's always the surgical sense. I always say ना, surgical sense is there. तो वो surgical sense हमेशा रहता है, और that surgical sense has always pushed me up, despite lot of people thinking a lot of things that this might happen, that might happen. But when you are actually having that surgical sense, you always pass that tough time also very smartly. You know? So this happens when you are a surgeon. Many a times you also have your patients who get blotched up, or you can say complications happen. And that is the time. So, but by God grace, I have been always through them. सर डिमांड के हिसाब से चूज करना चाहिए, जैसे आपने भी प्लास्टिक सर्जरी के बताया, केविन हैज आस्क्ड. बच्चे ऐसी बात नहीं है, अपने आप को सोचो कि क्या अच्छा लगता है. या इफ यू वांटेड टू बिकम अ if you wanted to become a chef, a gourmet chef, so आपको gourmet chef बनना अच्छा लगेगा. या you not enjoy becoming a chef by a roadside ढाबा, क्यों नहीं, chef तो बने ही ना. So no, you have to decide yourself. Yes, I wanted to be a urologist, I wanted to be a cardiothoracic surgeon, I wanted to be you can say a laparoscopic surgery surgery expert. So बहुत सारी चीजें होती हैं, you have to decide, and this decision you make when you are actually working. Yeah. So surgeons of NHS versus surgeons of India. Droop has asked. But it's a totally different, you can say, comparison scenario. So both of them are good, excellent. They have more, you can say, technical advancement. They have more technical advancement than us. But yes, we have more, you can say, exposure. You have more exposure. If you work in US or UK as a resident, you get you can say lot less caseload. You're more like an observer. But in India, thank God, because of poverty, there are a lot of patients who still cannot afford a quality care in the private setup, so they have to go to the government setups, and then you get a lot of hands-on. And then second thing is, thanks to the administration who always keeps the medical budgets to be very low. So most of the time the facilities are not available, so you learn how to manage with the minimum. So this is actually the advantage that you have when you develop. Like if you go to US, I'll narrate one very recent institute. One of my friends said, today I woke up at 4. I said, why? Because today we have a very special case. And what is that? Open cholecystectomy. Because open cholecystectomy, they don't get to see. हमारे यहाँ because they always do laparoscopic cholecystectomy, they are accustomed to that. हमारे यहाँ open cholecystectomy, everyone knows. There are people who don't know how to do laparoscopic cholecystectomy, but they know how to do open cholecystectomy. So ये advantage Indian surgeons का है. So when they go out and they perform, they are stuck. फर्क की पैदा है, we'll just convert it into open. This is what advantage they have. So नई generation जो आ रही है, they are not seeing the open conversions, and that is why it becomes very difficult for them to handle the emergencies. When they have to convert it into the open surgeries. So mixed exposure is very important. and this is what is makes India as a perfect place to learn surgery. So then what minor surgeries should a GP known at a minimum? Dekho, first of all, try to understand. As a general physician, behave like a general physician and don't try to do a lot of surgeries. You can do excisions, small excisions of cyst, etc. That is okay. But try to understand, आज की डेट में whenever you are doing any procedure under local anesthesia, you should have all that crash cart system ready with you, because even local anesthesia can result in anaphylaxis and cost a life. And then all those problems will arise. So when you are working like a general physician who has asked you to operate, और अगर ऑपरेशन करने का इतना ही कीड़ा था तो जनरल फिजिशियन बनने को किसने बोला था? So yes, do refer the patient. When you refer the patient, you get your share of payout also. ऐसा नहीं है, आप you'll never be at loss, because as a general physician when you are operating you'll not get a lot of money. So उससे अच्छा है कि वो patient किसी और को refer कर दो. Yes, you refer that patient to a surgeon, he'll give you at least 20% referral amount also. So वो आप उसी केस को 2000 में करते, उसने 10,000 में करके आपको 2000 भी दे दिए. You are also happy and he is also happy and the patient is also happy. You don't have to worry. You don't have to have the sleepless nights, and you don't have to think about a medical, you can say, legal summon against you. Yeah. So is my little introverted behavior okay for surgicals? बहुत अच्छा है, सब अच्छा है, सब अच्छा है. Over the time you develop, you learn the discipline, you learn. So once you throw yourself into that deep water, you'll always learn to make your way out. You learn to swim, you learn to make a balance in that atmosphere, in that scenario. So this is really very important, really very important. So as a you can say beginner, you should always play safe, learn, expose yourself to all those difficulties during your residencies, so that you have to sweat less when you actually step out. Residency is the most important time and you have to work for that. It was through you people that I came to know that the results are out. So I can just say, because right now I'm not knowing what score is going to be what, but I hope all of you must have done their best. जिसका अच्छा आया वो तो अच्छा है, जिसका नहीं आया, there's no, you can say, no question of getting depressed. You all will get anything. You all will get everything you want. Yeah. So कुछ को अभी मिलेगा, कुछ को इसके बाद मिलेगा. So always. So Devajyoti is asking, sir, is it advisable to opt for PG seat in South India, Bangalore, Kerala, if I am Northeast India? But no, there is nothing like you can say a lingual problem, because when you go to southern part of country, they are more disciplined, they are more enlightened, you can say they're more technically advanced, they follow the protocols, they're a bit strict, but this strictness is what is needed to develop, or you can say curate a sculpture out of you. So yes, I will always say southern part of country, you have excellent doctors, they maintain all the protocols. हमारे northern India में तो majority of the time you will see gutka, pan masala stuffed inside the ward boy's mouth, and then he's, when you go to southern part, you'll see that clean medical colleges, lot of people wanting to learn. Even the paramedical staff is helpful, they want to learn, they follow protocols, and the professors are strict, they teach you also, they want lot of dedication from you also. Yes or no? So this is the time to burn yourself, forget your ego. But ego you have to forget anyhow. Yes, if you are a male, there is no question of ego. शादी के बाद भूल जाओगे, सच अभी भूल जाओ. So when you are a PG resident, he or she, you don't have to think about your ego. Devote yourself. If your consultant says you are a man, yes sir, I knew that fact. You are good. Always be skeptical why he's praising you. Huh? So devote yourself to this stream for next 3 years. Any stream you go, anything you want to learn in PG as a resident, you have to bow down to get that. Don't think कि हमारे साथ इतना हो रहा है, ये टीचर ऐसा है, ये टीचर वैसा है, he's so cunning and that. No, they are not. But actually this is the professional decorum that you have to learn. So you have to go through that hardships, and remember, it is for all. It's for all. So Devyajyoti, it's always a plus to go to southern part of country. And the second thing is when you go to a different zone, you learn their language, and that is always a big plus. It's always a big plus point. Yes or no? So it's always a big plus point. So to learn their language, and when you come back to your own place, so you're multilingual now. Like I originally belong to Kanpur. You know Kanpur? Yeah, everyone must be knowing, na? Gutka, Pan Masala, yeah, Pan Parag, Pan Bahar, all those, yeah, great brands. They're all from Kanpur. Yeah, we actually have an identification, like Scotland is known for the Scotch. Same, Kanpur is known for the Gutka and Pan Masalas. But I did my MBBS from North Bengal Medical College, Darjeeling, and then IPGMR Kolkata. I did my residency. I stayed in West Bengal for a very long time, and now I can speak Bengali perfectly. So you have all the Bengali clients near my area, or in, you can say, around my matlab around 10-15 kilometers, and they know me. They want to come to me. They feel more comfortable talking to me. They think नहीं हमारा अपना doctor है. Yeah. So that is the advantage when you get when you know. So I have been in Darjeeling, so I know আমি অনেক ভালো আছি. So when I was in Darjeeling, so I knew a lot of I learned a lot of Nepali language also. Yeah. So at least when you see a Nepali patient, I can say, yeah, কষ্ট છો राम्रो છો, and pain in abdomen budi dukh છો. So that actually is the first connection that you make with the doctor. Remember, किस कॉलेज से पढ़ के आए, क्या करके आए, कितना पढ़ के आए, कितने मार्क्स मिले, गोल्ड मेडल मिला कि नहीं मिला. All of them are secondary. This is the client and the, you can say, doctor relationship. You have to maintain. Namaste. Dipesh, how are you? So if you have any queries, queries are often welcome. So you can ask your queries about the surgery. Results I'm not going to talk. Kevin, why you didn't settle outside India? I also regret this point because I had a very good offer to get settled in Florida, and but I could have gone. But the problem was that, again, when you get an invitation from, like, I got an invitation from Cleveland. So via some sources, as I'm doing robotics, so I have applied for an observership, and I could have settled down there. But the problem is, if you want to settle in US, you have to clear US Assembly so that you can be free to work anywhere. Is that clear? So if I go to Cleveland and settle down in Cleveland, and tomorrow, after, or maybe after 2 years or 3 years or 5 years down the line, I want to shift to a different institute, I cannot. The second thing, that is, I found my country to be more lucrative. Yeah. So right now I have 2 hospitals of my own. Yeah. And I could have not done this easily in US. You know? India may I have done it, and that too at very less age. You know? But I would have not done. Now from here I have created my footsteps. Now I have a good network in European countries. I have a good network in South African countries. I have good network in the, you can say, the Middle East countries. I'm going for surgery. I have got a lot of invitations after COVID. Once the COVID gets over, or if it doesn't get over, maybe as we all get vaccinated and the cases go down, I'll be traveling. I'll be flying to a lot of countries like Bahrain. I'm planning to set up an institute in Bahrain also with one of my friends. So hey, so India is India. We can easily settle down here. Litigations are far less. How can I, Rahul? How can I comment on the rank? Rank is so. Kahin bhi karo. You can always go as a, you can say, guest surgeon, and you can always operate anywhere if you are a renowned person. So Dipesh, you asked something. MRCS versus MS. Oh, I'm a scope of MRCS after MS. Remember, it's only a brand. A brand that you adore. Yeah. Try to understand. MRCS is a licensing exam. So once you clear that, you have to go to the if you go to UK and then you have to apply again for the, you can say, fellow FRCS program, which I think it's stopped right now. So India may, it's only a, you can say, a degree. It's not a degree, it's a tag which you can just boast of. So MS MRCs, that means yes, you are equally acclimatized to the US or you can say the European standards. So यही एक एडवांटेज होता है इसका, कोई बहुत ज़्यादा स्पेसिफिक कोई बहुत एडवांटेज नहीं है. या इन कॉर्पोरेट्स व्हेन यू गो फॉर इंटरव्यूज, या दे कंसीडर दिस थिंग बिकॉज यू आर वेल ट्रेन्ड इन योर एटिकेट्स टुवर्ड्स योर सब्जेक्ट, बस और कुछ नहीं है. इसके अलावा ऐसा नहीं है कि इफ़ यू डू ओनली MRCs आफ्टर MS यू आर एंटाइटल्ड टू डू प्रैक्टिस, है ना. सो ऐसा कुछ भी नहीं है. सो दिस इज very simple stream. This is surgery is very simple stream. It's only 3 years of hard work, and then if you want, you have to add 3 more years to get a specialist degree. Remember, you might be thinking 6 years is a big time, but 6 years flows away like this. You don't even get to know how the 6 years pass. But yes, after 6 years, the product that is created, you're actually awesome. Yes or no? You're actually awesome. So don't think of settling late. Don't think about this ki I'll settle so late and this and that. Think that what is the final reward. The longevity of your career is far more here. This is there. So if you are only opting surgery as a branch, I just want, because surgery is good, I want to become rich. ऐसा नहीं है, ऐसा बिल्कुल नहीं है. Surgery is not that highly rewarding branch for all. It's only for few. But yes, you enjoy your work. Like I am obsessed about surgery, so I am obsessed. A day, if I don't get a surgery, if I don't get a case to operate, I always feel that yes, my day is not complete. It's like a dessert to me, which I need after, you can say, every meal. So I need the surgery every day. So if you talk about me, I will always say surgery is plus 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 plus. Then second, most of the females ask, sir, is surgery good for females? Yes, awesome subject. Aram se. Bro, sir, not placating you, but this session is best. Thank you. And is there any way I can connect with you? I will be elated. Dhruv, you can always come to my new hospital which is opening now. So it's always open for all my residents. Many residents come to my hospital every day. So my new hospital is there in Dwarka. It's getting opened, I think, in the first week of November. So you can come there, stay there, learn there, and everything is free. We don't charge anything. Rather, I'll teach you a lot of things. Yeah. So you can interact with my patients. You can talk to them. You can be in my OT. I always keep on narrating the things, and my patients also enjoy this thing a lot, interacting with young doctors, and they feel good. They feel that yes, they have been taken care of. Yeah. So अच्छा ही लगता है. You can always come to my hospital and yeah, we'll have a good time. And I always treat my kids with lot of love. Yeah. So I will take care of everything. You just come, you just enjoy. Whenever you feel bored, whenever you get time, when you are alone, breakup हो जाए तो भी आ जाओ. You'll just learn something. You'll learn the pain that other people are having. So वो depression अपने आप ही चला जाएगा. Yeah. बच्चे category wise 7502 general category OBG branch in Maharashtra. Suchita, I cannot tell this time this right now because there are a lot of people who are more expert in this analysis of marks and ranks. I don't consider myself to be a teacher of a very good quality so that I can understand, I can explain this marks, this rank, this college. But yes, I wish you get your branch and wherever you want it. You want it in Maharashtra, you should get it. So I actually fall a bit lower in the ranking in that part because I don't know a lot of things, lot of skills of teaching. I am a raw, hardcore surgeon, and I just represent my branch to my people, whether they are my students, whether they are my clients. I just enjoy interacting with them. I just enjoy explaining with them. I just enjoy sharing the videos and then talking, and I do surgery and explain them the video. Okay, this is what I did. They see, oh my god, this was removed, and then explain, ये ऐसा होता है, ये ऐसा होता है. That is the best thing that you get. पैसा तो बहुत मिलेगा, but पैसे के साथ swag भी मिलना चाहिए. What about in Rajasthan 550? I'll take a separate session where I'll comment on what rankings and what expected marks, because I cannot say about marks right now. uh, I cannot talk about marks because ultimately what and how other people have performed and what rank you get, I can say हाँ यहाँ पर ऐसा हो सकता है. Prince Zuko, sir, any knowledge that you gained during practice that isn't in the book? Everything that I have gained now, you know, everything that I have gained in surgery is only by my practice. You know, you people study books more often than me and in more depth than me. But surgery is a branch which is a skill. A skill cannot be read and learned. A skill has to be practiced. So definitely I have learned everything. And one very big thing, one very important thing that I have learned which is not there, how to tackle complications. Bache, you may be the best surgeon, you may be the best doctor, but complications happen with everyone. And you know, a single complication, your whole reputation is gone. Why? Because people, there are so many people. Like, I have done a Mirzi syndrome case. Mirzi syndrome, everyone knows. It was a type 2 Mirzi syndrome with a fistula. And post-operative, I've counseled the patient that there will be a biliary leak. I have put a drain patient. We might require to go for a second surgery. And you know, this happened and patient started to shout. He brought so many people, local people, ki doctor ne nas kaat di, and this and that, blah and blah. So the practice teaches you that skill to counter. Actually, there should be a chapter like this: how to tackle mob, how to tackle crowd. Yes or no? So this is the thing that I have actually learned with over the time. I have acquired it over the time with my clinical, you can say, practice. Yeah. Shorjit wants to ask, sir, why everyone says for surgery it requires more time to settle down? Definitely, बच्चे, एक physician से आपको दवा खानी है, या a physician prescribes you metformin, you'll accept it, and then you need to get cut and operated by a person. Then you need to have the best of the best, you can say, skilled hands. Because एक दवा खाओगे बहुत ज़्यादा क्या होगा? Gastritis of a wrong medicine will seldom kill you. A wrong judgment in surgery will either dysmorph you or will either kill you. There is no second chance in surgery. There is no retake in this branch. And that is why, in order to learn discipline, some people spend their whole life and they don't acquire that skill. Some people acquire, but they take time to display that. Take people in confidence. How do you expect people to be? Yeah. You can say people coming to you and getting operated, they want a reference कि नहीं आप मेरे को बताओ ये कौन इस एरिया में अच्छा सर्जन है. ओके, नहीं यार मेरे उन्होंने कट इस इनसे ऑपरेशन करवाया था, ही इज गुड, एंड देन ही इज कमिंग टू यू. दैट इज हाउ दिस ब्रांच इज. सो यस, इट्स अ लेट सेट. खुद का सेटअप, केविन, खुद का सेटअप, ऑफ कोर्स लोन लेके और कॉर्पोरेट जॉब. बच्चे देखो, इफ यू रियली वांट टू बी अ किंग, and as far as surgery is concerned, if you really want to dominate, have your own setup. Because even if you work at a lower rate in your own setup, you get that chunk of money. आप कॉर्पोरेट में कम पैसे करोगे, वो कहेंगे 40,000 की सर्जरी 30,000 में कर दो, कहेंगे ठीक है कर लो, बिकॉज दे विल टेक दैट 30,000. वो कहेंगे आपको क्या चाहिए, व्हाट डू यू वांट, नथिंग. सो दिस इज व्हाट हैपेंड. Nanda says, do I need to be economically sound to take surgery? Let me tell you my very personal story. Yeah. You know, when I married, and बहुत सारे बच्चे पूछते हैं आपकी कहानी क्या है, कैसी है, क्या है. So Venkatesh, I'll answer you also. So when I married a lady, yeah, मुझको, I was left alone by my parents and everyone. Yeah. So I started from scratch. Zero means zero. ठीक है, I'm from a very well-to-do family, but I was alone. I started with zero. ठीक है, and today I have everything that I wanted in my life. Yes, I have made my 2 hospitals. I have not taken any support from my parents, with God's grace. Their blessings are there with me, and that is more than enough. So ऐसा कहीं भी नहीं लिखा है कि you have to be very sound to, financially very sound to take surgery. ये गलत है, बिल्कुल ही गलत है. Yes. So let us try to understand Acha, Venkatesh has asked how to prevent mob attack. Now, this is a very strange question. You have to understand when you are being attacked, run away. देखेंगे बाद में क्या होगा. This is the best thing. Save yourself first. Don't get in hands with mob. And then, like me, I am running a hospital. I cannot run away. So I keep my personal bodyguard, armed bodyguards, and a group of bouncers with me. At least 7 bouncers, and two or three basically armed guards. So ये चलता है यार. So now it's around. It's a long time now. It's a long time these things happen, and I was never having this opinion that a doctor should be having bodyguards, etc. But I still remember I did an appendicectomy, and there was an appendicular lump. The moment I started my dissection, there was a colonic perforation. I did a laparoscopic repair also. Everything was fine. Patient passed stools also. Day 4, there was constipation. Someone in the ward advised give enema, and the enema was given, and there was a leak. Yes, and when there was a leak, the patient developed perforation peritonitis. I did a second surgery. Colostomy was done, and patient couldn't make up. And they were saying, return my wife to me, and this and that. Lot of emotional assessment, you can say attack, and then 200 people surrounded me, and I still remember that night how I saved myself. And that was the day I said, okay, I will give some portion of my salary for my security also. And then that is how I decided to that I'll keep my armed bodyguards, because I just stopped practicing. Why will I stop practicing with the fear of these goons? है ना? Yeah, they are goons, तो मैं भी goon बन जाऊंगा. Yeah, वो गुंडे हैं तो हमसे बड़ा गुंडा थोड़ी कोई होगा. Yeah. So today, if someone wants to meet me, he has to pass through a series of checks. Yes or no? And they know कि भाई don't mess with this boy, or don't mess with this person. So you have to be. You cannot. कहते हैं ना इस you have to be equally. You have to be at par with the crowd if you want to. आज का crowd चाहता क्या है? आज का crowd चाहता है रंगबाजी. This is the word that is रंगबाजी, that we say describe as swag. तो बच्चे जब तक वो रंगबाजी नहीं होगी ना, वो स्वैग नहीं होगी, पर्सनालिटी में वो दबंगई नहीं होगी ना, you don't have that influence. When you see a doctor walking past you with 4 bodyguards, जैसे कुछ तो होगा बॉस, फालतू में तो नहीं रखा है. So that again is a marketing strategy also. Yeah, I'm taking out their salary from their pocket only. मैं पहले 50,000 में करता था सर्जरी, जो वो मैं 60,000 में करता हूँ. At 10,000 share, they are actually contributing for my security. This is how we have to, this is a bloody business. What do you think? बच्चे सर्जन के पास छुरी होती है तो भोग थोड़ी दोगे. सर्जन की जो छुरी होती है, डॉक्टर्स आर इन वेरी, वो मारेंगे ना, they will handle. So this is the marketing. If you're getting discount, it is from your own pocket that you are paying for the discount. So I was not having this notion. I would have been operating that same surgery if the things were normal for maybe 50,000 only. उनकी वजह से, लोगों की वजह से I kept them. अब उनका पैसा तो मैं उनसे निकालूंगा. So how to compete as a new surgeon in a city where already a lot of reputed surgeons have established? Let me tell you, Yash, my story. I'm very thankful to my sir, Professor Basu. When I started my journey, sir said, पहले दिन से operate करना, day 1 से. And when I entered into the stream, I always introduced myself as a consultant. I never said that I'm doing it for the first time. Inside me, I was knowing that I'm doing it for the first time. Every day, the lie that you actually recite, I'm a consultant, and you aim at becoming that. And you realize that very soon you become that. But be honest to yourself. Respect your patient. Work for their benefit. Work for them. You have to burn yourself because you're not at par. So just calling yourself consultant and not performing that job, it's not right. So we actually, that is why I always counsel my kids. Don't fear. क्या होगा? Maximum thing. Yeah. Congratulations, Tanzim. You got. अब बच्चे मैं क्या बताऊँ, ये तो वही बात हुई, पंडित जी मेरा हाथ देख के बता दो. लड़की गोरी मिलेगी कि लंबी मिलेगी, अंग्रेज मिलेगी, क्या मिलेगी, कैसे बताऊं यार कैसी रैंक आएगी यहाँ। मतलब ना यू वांट टू क्रैक अ जोक, मेरी मौज ले रही है। सो आई हाउ कैन आई गेस, हाउ कैन आई गेस, हाँ, to try to understand that. Such a lovely session, yeah, you know. I hope you people enjoyed. I also enjoyed. If you have any queries, otherwise हम तो गप्पे लड़ाते ही रहेंगे. This will keep on going and going. Okay. So yes, at the end, I will summarize. If you want to go for surgery, yes, you should have that mettle. You should be mentally prepared. कि yes, I want to become a surgeon. It should not be peer pressure कि नहीं मेरी गर्लफ्रेंड को सर्जरी से ही बस शादी करनी है ना, मुझसे नहीं मेरी ब्रांच से शादी करनी है, ऐसा नहीं है. You should be obsessed about that branch. Yeah, I want to. So you will always become a surgeon. So one thing that you have to understand, बच्चों results are out. You all have done your hard work. You all have done your best. The only thing that you have to understand is there are some people who have performed a slight better than you. They might get it this time. You might get it next time. कुछ नहीं फर्क पड़ता है एक साल लेट होगा या नहीं होगा. But yes, do take the branch which you actually love. ऐसा नहीं कि प्रेशर में आके कुछ भी कर लेना बच्चे, कभी भी अपने आप को माफ नहीं कर पाओगे. I wanted to become a surgeon. I am a proud surgeon, and I know that the last breath that I will be taking, yeah, I will be happy that I became a surgeon. I wish I die in my own scrubs. I request this to my family members also, when I die, burn my scrubs also with me, or whatever you want to do. So इस चीज की खुशी रहेगी. पैसा कमा पाया या नहीं कमा पाया, that is different thing. But I got my branch. That is what is. So all the best to all of you. Let us see what ranks do you get. But everyone will get good rank. और बहुत अच्छा लगा. It was really you can say awesome session. After so many days, I'm feeling so light talking with you people. It's just chit chat like conversation. So anesthesia is beautiful. Yes, surgery वालों से पूछ रहे anesthesia के बारे में. They are the one who actually delay the case a lot. They are the one who actually cancel the case a lot. They are the one who don't want to give anesthesia to patient. But actually they are really very good. They are very humble people. Yeah. So surgeon anesthetist की, anesthetist surgeon की बहुत बुराई करते हैं. But try to understand कि साथ में शाम को सब साथ में बैठते हैं. So we all are चड्डी बड़ी friends है ना. So anesthesia is equally very good branch. Yeah. For both male and female. Everyone is good. Lot respectable. So टॉपर के मार्क्स कितने बच्चे देखो. देर आर लॉट बिग टीचर्स ऑन दिस प्लेटफॉर्म इन दिस वर्ल्ड. आप लोग खाम का मेरे को रेस्पेक्ट देते हो, मेरे को खाम का यू कंसिडर मी टू बी अ टीचर. आई एम नो टीचर. आई एम अ फ्रॉडस्टर. आई एम ओनली अ सर्जन. मेरे को टीचर वीचर मत समझो. दैट इज वाई आई लव टू कॉल माई सेल्फ अ दादा. What do teacher word na, it has a lot of gratitude, and I think that I have not attained that level that I could be called as a teacher. I love to be called like a dada, and like a mentor I want to guide you. Whatever little information I have, I share with you. Whatever little experience I have, I share with you. And that is what there will be a lot of people who will tell you about what rank कितने में क्या आएगा, क्या करना चाहिए, क्या नहीं करना चाहिए. बच्चे मैं बस इतना कहूँगा like a senior, I am opening my heart to you. करना वही जो दिल को पसंद है. Is that clear or no? किसी के प्रेशर में नहीं, ना लड़की के, ना घर वालों के, ना अपने प्रेशर में. Because you will never be happy. You will never be happy. Become what you always wanted to be. And there you will get the maximum benefit. Is that clear? Suppose if you wanted to become a surgeon, you will enjoy becoming a surgeon. If you wanted to become a physician, you will enjoy becoming a physician. अगर नहीं बनना चाहते मत बनो ना. MBBS कर लिया, फोटोग्राफी करो, ये करो, वो करो. There are a lot of odd jobs. Yes or no? So I'm saying, may God give you all the, you can say, good ranks. May all of you get their dream branches. I wish for you all, है ना. And don't get depressed. मैं उनके लिए ज़्यादा बोलूँगा जिनकी रैंक नहीं आ पा रही है या जिनका स्कोर अच्छा नहीं है. Don't get depressed. This world is huge. There are a lot of opportunities that you have already secured for yourself. You have already secured a minimum level of social respect and social security and financial security. So just enjoy this phase. Just enjoy. Ophthalmologist is again a very good. Ophthalmology is a very good branch. Yeah, and it's fun doing. If you love to become ophthalmologist, it's yes. मतलब यार. So please tell me to drop years matter in medical career and in finding job. अच्छा एक बात बताओ. अर्बन मॉन्क आपको पता है कि मैंने कितने साल ड्रॉप किया? डू यू नो? डू यू रियली नो हाउ मेनी ईयर्स आई हैव बीन प्रैक्टिसिंग फॉर? बहुत सारे बच्चे पूछते हैं या सो देयर आर लॉट ऑफ पीपल हु आस्क सर हाउ लॉन्ग हैव यू बीन प्रैक्टिसिंग, हाउ मेनी ईयर्स? कोई इज देयर रिटन, इज देयर एनी डॉक्यूमेंट विच टेल्स कि नहीं इसने 4 साल ड्रॉप किए, इसने 5 साल ड्रॉप किए, ये इतने साल से प्रैक्टिस कर रहे? नहीं. सो ट्राई टू अंडरस्टैंड. It is your presentation which matters. Remember, age is just a number. There are people who do a branch at age of 50 and they are more, you can say, lively, they are more, you can say, presentable than the people who have been in this branch for last 50 years. Samjhe? So why you people are demotivated, bache? You have to be more strong. Everything that you do, every act of yours should be your own. You should be carrying your own justification. ठीक है ना? कि नहीं इस बार नहीं कर पाए अगली बार कर लेंगे. यस और नो? इस बार नहीं कर पाए अगली बार कर लेंगे. यस या डेफिनेटली. बच्चे केविन आई विल ऑलवेज से बी हैप्पी. बच्चे क्या होगा? बहुत ज्यादा नहीं कर पाओगे, बहुत ज्यादा नहीं कर पाओगे. या दिस इज व्हाट. ऐसा कुछ नहीं है. यू हैव ऑलरेडी डन. यू नो, मैं आपको एक असलियत बताऊं. एक आरएमओ ज्यादा कमा रहा है आज की डेट में एक गवर्नमेंट हॉस्पिटल में एक सर्जन से ज्यादा. एक आरएमओ आराम से एक मेडिकल ऑफिसर एमबीबीएस करके उसकी सैलरी 70-80 हज़ार है. शाम को एक नर्सिंग होम पकड़ रखा है, वहां से उसको 80 हज़ार आ रहा है, 1,60,000. हम जाके कॉर्पोरेट में अपोलो फोर्टिस मेदांता में 1,10,000 की नौकरी कर रहे हैं. बताओ कौन बेवकूफ है, मैं कि वो? एक झूठा स्वैग है. वो खुश है, पैसा भी कमा रहा है, इज गेटिंग टाइम ऑल्सो, लेसर रिस्पॉन्सिबिलिटी. सिस्टर के साथ भी फ्लर्ट करता रहता है पूरी देर इमरजेंसी में. हम तो कुछ भी नहीं करते. सो वो एक थॉट प्रोसेस. जस्ट चेंज दैट थॉट प्रोसेस. दैट इज नॉट फॉर यू ऑल. डज इट रियली मैटर इफ यू हैव ड्रॉप्ड फॉर 3 years? Does it really matter? And really, for the people who are dropping, you know, I've started a 6 months fellowship course, surgery fellowship course, which is again starting for MBBS students. So always, you can also behave like surgeons. You can also have that attitude. You go to periphery, practice strong. You know, at least I can guarantee if you stay there in my center for 30 days, you'll at least learn to do a lap cholecystectomy. But I'll not advise you. ना ऐसा नहीं बोल रहा हूँ. बच्चे 3 क्या 30 ड्रॉप भी लगा दें अगर मुझे मेरी पसंद की मंजिल मिले. इज दैट क्लियर और नो? सो हार्डली इट मैटर्स हाउ मेनी ड्रॉप्स यू हैव क्रिएटेड. यू हैव टू बी सक्सेसफुल. दिस इज द मंत्रा दैट यू हैव टू ऑलवेज रिसाइट इन योर, दैट आई हैव टू सक्सेस. इस साल नहीं, अगले साल. बच्चे 2 years हैव पास विद कोविड, पता ही नहीं चला. सो ईयर्स पास जस्ट इन अ यस लाइक दिस. पैसा मिलता है. So enjoy your day. I salute to all of you. Stay safe. There are a lot of people who love you. There are a lot of people who care about you. All the best to those who have actually secured good marks. And again, all the very, very best to those who couldn't do it. Will do it next year. समझे कि नहीं? So ये मत सोचो. You don't think you have lost anything. You haven't lost anything. You have everything with you. You know, you have everything. ऐसा नहीं होता. Don't find yourself guilty. Don't think that you have done anything wrong. You did your best. Maybe someone did better than you. बस अगले साल हम फिर से करेंगे, है ना? So चलो. So let us just conclude this session. Otherwise, this is going to just increase in length and length. There will be a lot of good educators who will be actually guiding you in all these things. But as far as I'm concerned, I love all of you. or I don't want anyone to be depressed. Yes or no? And bas khush raho. Just be happy. Take this, take these results as a positive reinforcement. Those who will get a seat, they will also enjoy. Those who couldn't get, prepare for the next year. Heck yeah, we have a lot of new courses on Unacademy. We have discounted courses on Unacademy, so don't worry. So very soon I'll be again conducting a session once we get the ranks out, and then I'll conduct how to approach for the surgery, how to opt for the colleges, what colleges should you be opting, DNB versus MS, everything I'll be discussing in that session once again. So today is yours day, enjoy. Yeah. So till then, bye bye, bye bye, bye bye. I hope you enjoyed. I really actually enjoyed today. I really actually enjoyed. Till then, bye bye.